In this screencast, we'll talk about blood groups or blood types, as well as transfusions, and some of the things we need to be careful for with transfusions, some of the problems that can occur if we're not careful. Before talking about blood types, we first need to talk about antigens and antibodies. Antigens are any molecule that triggers an immune response, so we can think of them as foreign invaders if they are truly foreign. However, there are antigens that are innate to us, that in this case are determined by genetics, and so they're just markers. They are markers on the red blood cells. We know about 32 different antigens, but the most serious reactions that can occur are from the ABO and the Rh groups. So two separate groups, the ABO group of antigens and the Rh group of antigens. So those are the ones we focus on when we're determining blood type. Again, if an antigen is foreign to you, that molecule is going to trigger an immune response. If the antigen is not foreign to you, then your body will just recognize it as okay and it won't trigger an immune response. When we talk about immune responses, we're talking in this case about antibodies. So when your body detects an antigen or a molecule that's not found in its own body, so it's foreign, it will produce antibodies to fight it. We know about antibodies from talking about different illnesses, vaccines. Right now, talking about the COVID vaccine, whether or not you have antibodies already from COVID, if you've had COVID, but they can be from anything. You have antibodies against the measles if you've gotten a measles vaccine. You have antibodies against chickenpox if you have had the chickenpox in the past. And so you have antibodies. Antibodies, again, are going to fight off foreign invaders in order to protect the body. Agglutination is the response of antibodies attacking these specific blood antigens. What's going to happen is if you get a mismatched blood transfusion, so you have foreign antigens enter your body and they're not ones you already have in your body, the antibodies in your body will attack it. They'll attack these incoming blood cells, which causes a clumping of blood. It usually begins with symptoms like anxiety, headache, pain, just kind of more general symptoms, and eventually the red blood cells will rupture and cause organ failure. So when we're talking about our first group of blood antigens, we're talking about the ABO blood group. There are two antigens on the surface of our red blood cell in this group. The first one is the antigen A, and the other one is antigen B. You get these antigens from your parents. So if you have A antigens and only A antigens, you have type A blood. If you have B antigens and only B antigens, you have type B blood. If you have both A and B antigens, you have type AB blood. And if you don't have any A or B antigens, you have type O blood. Now, remember antibodies. When you are first born, you start developing antibodies to all different kinds of things that you're encountering in the world, including you're developing antibodies against blood antigens. So if you have type A blood, then A antigens are innate for you and B antigens are foreign, so you develop anti-B antibodies. If you have type B blood, you have B antigens, so A antigens are foreign to you, and you develop anti-A antibodies. If you have type AB blood, both antigens are innate to you, so neither one is foreign, and you don't develop any antibodies. If you have type O blood, you don't innately have either antigen, and so you develop both A and B antibodies to fight off these antigens if you were to ever come in contact with them through a transfusion. Again, when you're talking about type AB blood, you're just talking about them not having any of these blood antibodies. They do have other antibodies for other things. So if we look at this picture right here, it's just a quick summary. You can see in this first one, you have type A blood. You can see the little A antigens sitting on the red blood cell. And because B antigens are foreign to them, there are anti-B antibodies in the blood plasma. In type B blood, you have B antigens here marking the surface of the red blood cell, and so you have anti-A antibodies. Type AB blood has both antigens on the surface of the red blood cell, so they don't have any ABO antibodies. And then type O blood does not have any antigens on the surface of the red blood cell, so they do have both anti-A and anti-B antibodies. This is important when we get a blood transfusion because it affects which types of blood we can receive in order for our body to accept it and not have an adverse reaction. Type AB blood is known as the universal recipient. Technically, type AB positive. We'll talk about the positives and negatives in a minute. And type O blood, specifically O negative blood, is the universal donor. When you look at the chart, you can see that if you have A blood, you want to always get your own blood type. So you can see here, you want to get your own blood type. However, if you can't get A blood, you could also get O blood. The reason is that O blood does not have any antigens that the A blood will fight off as foreign. B blood can also get O blood for the same reason. AB blood wants AB blood as the first choice, but you could also get A blood, B blood, or O blood because there are no antibodies in AB blood, and therefore they're not going to fight off either of the antigens. Lastly, you have type O blood. Type O blood can only get O blood if they got either of the or any of the other three types of blood that have A or B antigens. The antibodies in the O blood would fight off the incoming antigens and cause agglutination. So that's the ABO blood type. Now we have the positive or negative part of your blood type. The Rh blood group, which is named after the rhesus monkeys it was first studied in, is where we get our plus or our minus, our positive or our negative. If you are Rh positive, you have Rh antigens. If you're Rh negative, so you have a negative blood type, you don't have Rh antigens. And just like the A and B antigens, these are found, the Rh factor is found on the surface of the red blood cells. It's named, there are several Rh antigens. Antigen D is the most prevalent, and so that's the one we're really looking at. Again, someone with type A positive blood will have A antigens as well as Rh antigens. Someone, and that's why we go back to this chart, if you're AB positive, that's really where you're the universal recipient. If you're O negative, that's where you're really the universal donor because you don't have any Rh antigens either, so you can give those to positive or negative bloods. When we are talking about Rh negative people, they're only about 15% of the population, so most people do have positive blood. And you want to still try to match blood type. So if you're Rh positive, you can get positive or negative blood. If you're Rh negative, you can only get negative blood. Generally speaking, the first transfusion isn't really a big problem because unlike the A and B antibodies, the anti-Rh antibodies are stimulated after the first transfusion, so you become sensitive to it the next time. However, we still try to give Rh negative people Rh negative blood the first time too, so that we don't cause any problems. But you could be okay the first time, we just try not to. So again, if you have negative blood, you can only get negative blood. If you have positive blood, you can get positive blood or negative blood because you don't have the antibodies that are going to fight off any incoming antigens. The last thing we'll briefly talk about is blood type and pregnancy. So your blood type is determined by genetics, which blood types, which alleles you get from your mother and your father. And so mothers and their baby or their fetus can have different blood types. The problem here is when the mother's antibodies would go and attack the baby's antigens. Keep in mind, the baby doesn't start to develop its own antibodies until after it's born, right? 2 to 8 months after it's born. So the problem we're encountering or could encounter here is that the mother's antibodies could cross the placenta and attack the baby's antigens if they have different blood types. However, the anti-A and anti-B antibodies are too big to cross the placenta, so that's not going to be a problem. The problem is with the Rh antibodies. So if the baby is Rh positive, the mother is Rh negative, the mother's anti-Rh antibodies could cross the placenta and attack the baby's blood cells. It would attack the red blood cells, which would cause something called erythroblastosis fetalis, red blood cell splitting in a fetus. So what we do to counter this is that an Rh negative mother will usually get an injection if she has an Rh positive baby, and this prevents her antibodies from going across the placenta to attack the baby's blood. So that is a brief overview of ABO and Rh blood types. Again, we combine the ABO group antigens with the Rh antigen in order to get our full blood type. Antigens are markers or molecules that can either be innate to you or foreign to you. And if they are foreign, they will trigger an immune response through antibodies attacking the foreign antigens.